Hi everyone, this is Jessica Shields and this is Discussion Board 6. I am replying to Shaketa's post. Your post was very good and very thorough. You explained in great detail, answered all the questions, and gave a lot of good examples of opioid use and opioid addiction and signs and symptoms. I can definitely imagine how you would see a lot of patients needing pain control on a general surgical unit. You know, after you have surgery, you definitely are in pain. So I bet you see a lot of patients needing pain meds, and it is pretty significant the percentage of patients that have moderate to severe pain after surgery. You said 80%, which is, it definitely makes sense. And I definitely agree with you when you said that they're probably not given enough analgesia during surgery. I'm sure that's kind of hard to regulate whenever the patient's not able to tell you their pain rating, and their vital signs are usually somewhat stabilized by the anesthetics. So I'm sure it is kind of hard to regulate there. And I definitely agree with you when you talked about how unrelieved pain can lead to multiple different things, such as poor wound healing, DVTs, PEs, and it can also lead to depression and anxiety. It definitely all stems together, and it makes sense. Because if you're in pain, you're not going to move. You're not going to move your legs. You're not going to increase risk for blood clots, and you're not going to want to do anything. So that can probably lead to depression. So it definitely all stems together and makes sense. I agree with the signs and symptoms, the difficulty sleeping, increased vital signs. That's definitely some factors that us as nurses monitor the patient for, because we have some patients that will always tell you they're not in pain, and in reality, we know that they probably are, because they just had surgery, or because they've had multiple back surgeries, or whatever it may be. So we definitely look for them not being able to sleep, them not being able to be comfortable, very restless, increased heart rate, and other things of that nature. And some of the signs and symptoms of someone using opioids, I agree that usually they have a flat effect, or mood swings. Either they're happy one minute and flipping out the next minute, or vice versa, whatever it may be. But and they're also usually unkept, maybe dirty clothes, hair not brushed, just that are those are also some of the indicators that someone is using or abusing opioids. And you brought up the example of how a coworker was using pain medications and taking them from the patients. And it is amazing the number of medical professionals that are abusing drugs and getting them from patients and getting them from hospitals, or writing their own prescriptions. I know a few doctors that got suspended from where I work because they were writing them, or they were writing family members prescriptions and then getting them filled. And it's just amazing how many people risk their license and risk their careers and their life, because you can get locked up for that stuff. But it's crazy because it takes so long to get to where you are. So much hard work, and with nursing school or being a doctor or whatever you did, it is pretty amazing how they're just gonna throw all that away, and just for a high, or just to get some pills. And and they're sacrificing the patient's well-being by doing that. You know, I mean, if you have to take pills, go get them on your own. Don't steal them from patients who actually need them. You know, it's just crazy. These people who take medical oaths and then, you know, go against everything that they are saying they're doing. So opioid addiction is a very terrible thing, and it's very common. You'd be surprised how many people are, once you start researching, how many medical professionals are addicted to opioids. That's it. Thank you.